and our country at large. To sensitize everybody that by having to take drugs, it doesn't help. It might have an immediate effect which could be positive, but at long term it destroys the body, because whatever we take into our body that does not give us vitamin, that does not heal us, it destroys our body. But what I want all of us to understand during this period here, we should be able to identify some of the drugs that are in our midst. Some of those drugs, we use them without knowing. Some of those drugs, we don't even know them, but they are just there. Some drugs can be very near before we realize.
Some of the street children invited in the educative talk give testimonies and promise to change their lifestyle.
J'ai laissé tomber les places mon problème en dessous. Ils sont vachement réfléchis. C'est dans la vie, le cannabis. C'est 4 fois. Quand il marche avec maintenant. Ils sont dans le temps maintenant. Merci beaucoup.
Bon, moi je me nomme Pine Samba puisque bon, je n'ai jamais fumé l'alcool, mais j'ai vécu à côté de ceux qui fumaient l'alcool, donc quand ils fumaient, l'odeur qu'ils rejetaient m'affectait aussi. Donc ça me faisait alors trop mal, je me suis éloigné d'eux.
Je m'appelle Siani Yannick, je suis un enfant de la rue. Il y a eu l'opportunité aujourd'hui d'avoir une chance que peut-être je n'ai jamais eu, que les chers invités sont venus pour nous parler de la drogue. Ce que c'est la drogue, c'est quelque chose qui n'habitue pas dans la vie de l'homme et qui le gâte. Je veux aussi dire à mes chers invités, à mes chers papas, que consommer de la drogue n'est pas bon pour l'organisme. Et je veux dire à les chers invités qui sont venus nous rendre visite, à les chères mamans qui sont venus nous rendre visite aujourd'hui, qu'ils puissent continuer encore et Dieu les aidera, et qu'ils puissent encore plus faire mieux que ceci qu'ils en ont fait aujourd'hui, et que nous on ne s'entendait pas à ça, et qu'on a vu aussi ce qu'ils ont fait, nous a fait à manger, à boire, à donner beaucoup de choses que je ne m'attendais pas à ça.
What forms of drugs do you find in your community that are dangerous for health?
First of all, our country is situated in the middle of the Central African region, and we are of the equatorial forest. And this gives us an advantage to grow a lot of herbs. And so from these herbs, there are so many of them that can be poisonous and that can, be considered as drug. One of them is marijuana, popularly known as banga. The situation of banga in our country has become very, very, very disturbing, because in some areas of our country, some citizens have taken upon themselves to cultivate banga as a cash crop in the place of coffee and cocoa, banana, and you name the rest. And this situation is very, very difficult, to stop or to find a problem. The other worrying factor of the drug in Cameroon is alcoholism. Alcohol in our country is so popular that many Cameroonians no more realize that alcohol is a dangerous drug. For example, if we want to see about the distribution of alcohol in our country, this no more respects the rules or the law about the distribution of beer, wine, and even whiskey. In every house there is a bar. And the fear is that when the head of the family himself has taken enough alcohol and is drunk, the wife too is consequently suffering from that situation. Not only the wife, the children. Not only the children, even the neighbors. And so we can say in alcohol you have beer, you have wine, you have whiskey, and more especially we have traditional substance that also drunken very seriously, and that are very, very, very dangerous for health. One of them is what we call a fofo, African gin, and the other one is the plastic whiskey that is being distributed indiscriminately, even on the small counters beside the roads. We also have palm wine, which is well known. Palm wine, which is considered as our principal drink, but at a certain moment palm wine can become very dangerous too. And not only palm wine, we have corn beer, we have billy. In all regions of our country, this alcohol problem is uncontrollable. And now, the next problem about the kind of drugs that we find in our country is cocaine, heroin, and these tablets that they sell around the roads. The drugs that people sell around the roads. They are also very dangerous drugs. We see that even if people have to, sell those drugs around the road, the government should have a hand on the control of the distribution of those drugs. It is not the only thing we are talking about here. We are talking about also how those drugs are administered in hospitals on those people who are sick there. We know that our medical system, we have very reliable medical officers, doctors, and other specialists. But we have also noticed recently that sometimes when you go to the hospital, either the doctor is not there to see what the nurses are doing, or the nurses themselves sometimes they neglect their sick persons who are under them. And that is why sometimes somebody goes to a clinic or to a hospital without finding out whether the person has a certain disease that does not require sugar. They just take a drip and put on the person with glucose. And we have seen many cases like that where patients are dead. Meanwhile, if they really took time to find out the past health situation of that patient, they would discover that what they have to administer on that patient may not be the best drug for the patient.
The future perspective from NDAPA's plans seems to be widespread.
And as member of the National Campaign Committee, we are going to, also represent the Ministry of Health in the national campaign for fight against drug abuse. And so, during the first semester of 2014, we have been working in Boya, and we intend to go to Limbe during the next or the second semester to work with the children in school, to work with local communities, to work with the general public, so that we can, sensitize all these people for a change of behavior against drug abuse and other related public ills. So, for example, what drug can obtain to the health of a person, and it is really, really bad. We need to sensitize the public so that they can know that drug abuse does not only affect the public, but it also affects a human being, the health of an individual.
Before the data plans go worldwide, a further appeal should be done to the public.
Well, I want to give an appeal to all the stakeholders, being the parents, administrative authorities, educators, youths, and community leaders at the base, and the medias, private enterprises, associations and NGO leaders, civil sectors, individuals, to cooperate so that we can talk and reflect together to see how we can tackle drug abuse and trafficking in our society. We want to attain emergent Cameroon by the year 2035. This is an appeal that everyone should bear this project like his own affair.
Despite the climatic conditions sometimes very unfavorable for various displacements in towns to meet collaborators and others, NDAPA's plans has been carried out but still have some financial constraints.
You know, our members are not very viable as far as finances are concerned, and we count very much on these agencies and other well-wishers to help and see us realize some of our activities that require financial means and also other materials.